It is coming up to 3 minutes after 8. This is Kenya's biggest conversation, the Situation Room. In the room with you this morning is Nduoko and Eric Latif. CT Muga is well, he's away. He's handling some personal matters. Today's proverb, a wrong step by the leader, is a warning for those following. A wrong step by the leader is a warning for those following. We are speaking to some of our leaders this morning, and we want to understand the kind of steps that they've been making and taking. Do we need to be warned with what our leaders are doing? Do we need to be cautious of what the leaders are doing? Should we really be worried about what our leaders are doing or saying? This is the conversation that we'll be having. So we've heard from Governor Dr. Alfred Mutua of Machakos County, tweeted yesterday and said, look, guys, this is a situation. Our ICU and HDU facilities in Machakos County are full. We are not able to admit anybody into any of these two, ICU or HDU in Machakos County. And we've spoken to him and he said, this is because of the kind of situation that we are in. Despite the investment that has been put into the healthcare by the county government of Machakos, they've gotten to a point where, well, this is the best that they could do and that's it, the end. The Council of Governors has been having conversations. They had a full council meeting the day before yesterday, like Dr. Alfred Mutua told us, and they were looking at what is happening in the country. What do we need to do? They had a meeting with the chair of the National Emergency Response Committee, the Cabinet Secretary for Health, Mutahi Kagwe, last week. And they were talking about what they need to do to make sure that they are ready. Among the messages that we saw coming out of the national government, imploring on the county governments to do, is please make sure that those isolation facilities are ready. Please make sure that you have ambulances that are capable of at least being deployed fast. Those are conversations that are being held between the two levels of government at this point in time. We saw the question that was asked by the Cabinet Secretary for Health.
Where did the money go?
We gave these guys 5 billion shillings last year. Where did that money go?
And where are the beds?
Where are the beds now? Those are the questions that
are being asked. They want to know because it is not clear where all of this money went, number one, and why are we in a position of crisis today if a provision was made financially for these things to happen. Even if not to happen in its entirety, at least we should have gotten the ball rolling. And if that's the question that's coming from the Ministry of Health in terms of where did this all go, what work has been done, how much more than Kenya citizens now who are running pillar to post to try and get some kind of help medically when it comes to COVID? The question needs to be answered.
It does need to be answered. Let's bring in the governors of Kiambu and Laikipia. This is Governor Ndiritu Muriithi and Governor Dr. James Nyoro of Kiambu. I think one of you governors needs to mute your sound. Good. Now we're good to go. Habari za asubuhi, waheshimiwa.
Well, mzuri sana.
Governor Nyoro, Dr. Nyoro, asante sana for joining us for the first time on the show. Governor Ndiritu Muriithi, good to see you again on this show.
Good morning. How are you?
Good morning. Very well.
How is Odu?
Ndu is good. How is Laikipia, sir?
Laikipia is fine. We haven't seen you in Nanyuki all this time that we've been talking.
You know, we had a conversation with Eric the other day, and I said, you know, this Laikipia, this place, I want to go. I want to go to Nanyuki. And he said, there's an open invitation from the governor to come. Why have you not taken this invitation? So now that it's being said nationally, perhaps we need to take it up.
You better take it up. Now, Kiambu, you don't need an invite. You just walk in 5 minutes, you are into Kiambu.
You see?
And in 10 minutes back to Nairobi. So that one you don't need an invite.
Thank you, Dr. Nyoro. I like this conversation already.
And there are very many lovely places that you keep discovering every new day in Kiambu County. Some lovely waterfalls, some lovely places that you can just go scenic, take your family, enjoy, go back home.
Voila.
Yeah, very big tea farms, you know, just across here, Tigoni, and you come back refreshed.
You see?
Very good.
That sounds like a promo.
Absolutely, it does.
I thought, Eric, perhaps you would let us weigh in on the context.
Yes.
Because of this question you raised about 5 billion.
Yes.
And I hope you know, Eric and Odu, that the the monthly spend by counties is somewhere in the neighborhood of 32 billion per month. So if you take the equitable share, which is 26 billion per month, and their own source revenue, which is 5-6 billion per month, you will see that we are about 32 per month. So if you and Senator Kagwe ask what we've done with 5 billion over 12 months, I mean, come on, guys. I mean, we are not comparing like for like. So we need to put it in context.
Yes.
We also need to accept the truth about virus. A third wave was expected. So if anybody is claiming that this is unexpected, I think they are not following science. Now, it's also true that this third wave seems more severe than the first wave, or if you like, surge, than the first one and the second one. And scientists are scrambling right now because this surge appears to be driven by a slightly different variant of the virus. And again, this is not new science. This is the way viruses behave. The virus mutates. As you deal with it, it's also dealing with you.
Yep.
So for example, here in Nanyuki, one of the big things that has been going on is trying to see, because we had an incident where just slightly more than a dozen British soldiers who were in Nanyuki in their barracks seem to have, so we're trying to see, did the UK variant, seep its way into the general population?
Yep.
There are other efforts to see whether, and that's why you keep hearing about this genomics big word, because we have to sort of sequence the gene of the virus to understand if it is the same virus or it's a different variant. There's also the effort about is it also a South African variant, or is it in fact a third or fourth variant altogether?
Yeah.
So all those things are there, and I think that's the general context. I caught the tail end of your conversation with our colleague Mutua, and he is right. A lot of us have relaxed a little bit. I mean, I was in church on Sunday, and one of the things when I came out, actually, I had to call the Archbishop Muheria to say, look, I wonder if really we should do something, because the Mass Celebrant is handling the Holy Communion, by hand.
Right.
And I just wonder if that's not creating a risk to the whole congregation. So we have to keep innovating and looking at how to go back to very stringent following of, I'm not advocating we close the economy, but wearing of masks, the sort of thing we are doing now, using technology, you and ourselves, to do our work. We have to go back there, but we also have to realize that there's something to be said about the resources, and maybe we'll come back to that question. Let me yield to my colleague Nyoro, so that I'm not just hogging the time.
Yeah, sure, Dr. Nyoro. Also, the question for you, and looking at Kiambu as a dormitory county of Nairobi, for example, we've seen that a lot of people who are in need of care then have to come into Kiambu to get it. And we're talking about, you don't have an ICU, having to now cross over to look for help in Kiambu. So then there's an extra burden, obviously, on your county. That is clear. Before we even go back to this 5 billion shillings and the issue of money and where it went, or where it should have gone, how then, and what's your messaging? Because it seems that everybody has a different message now in terms of what we are telling Kenyans about the burden of this virus and how it has come about in this third wave today. What is happening in Kiambu, and how are you working through these issues?
Well, thank you very much. As you probably know, we are the second most populous county after Nairobi. And as if that is not enough, we are just very close to Nairobi. So whenever there are good things happening in Nairobi, we enjoy them. Whenever there are bad things, of course, we suffer. And one of the things happening now is that as the hospitals are getting full in Nairobi, people are coming to seek treatment and even admission in Kiambu. I can tell you that a week ago we had about 40 or so.
Oh, we lost him on the line. Let's bring you back, Governor Ndiritu Muriithi, as we have this conversation so we can try and reconnect with Dr. James Nyoro. So, Governor Ndiritu Muriithi, from just the numbers that we've seen coming out of Machakos County and the numbers that we see coming out of the other counties, and Governor Nyoro will tell us the kind of numbers that they're seeing in seeking healthcare in their facilities. What is the situation like in Laikipia?
Right now we have 9 patients on oxygen. We have none in ICU, although our ICU is very, very modest. We have a 10-bed ICU in the public hospital and a 3-bed ICU in private hands. So it's very, very modest. We can support 208 patients at any one time on oxygen. So we are not full, but clearly, as I've said, it is our facility is in any case modest, and we are a bit of a distance from the epicenter. I think that the thing, and we discussed this on Monday. The thing that we all need to see if we can ramp up is oxygen support, because what we have learned over the 12 months of this COVID is that the need, it's not just the ventilator. In fact, the ventilator is towards the end of the process. A big portion of it is oxygen support. So investments into oxygen, and maybe I'm getting ahead of the conversation here, but yesterday we spent a couple of hours with the folks at Treasury looking at different pockets of money that are owed to counties. For example, there is some 4.6 billion of Kenya devolution support, and looking at how it can be disbursed under emergency conditions to support counties. Because remember, Eric, in terms of cash flow management, we are 3 to 4 months late. Just on Monday, we were able to clear some half a dozen counties to clear their November arrears, meaning that we had not disbursed money to them since November. So November, December, January, February, we are into the 5th month, and we have not gotten a coin to them. Then, no, that was Friday. Then on Monday, we were able to clear, to push, we didn't quite clear, some arrears for December. So it's a daily thing that our engagement Treasury, and just yesterday we were looking at how we could get some 4.6 billion to counties in an emergency manner, following Article 223 of the Constitution, to allow counties to have a bit of flexibility, particularly in trying to increase oxygen capacity. We are also saying, Eric, that it's not just piped oxygen. You know, even at health center, you can actually provide oxygen, but you do it in cylinders and oxygen concentrator. And those are the areas of innovation and if you will, rapid expansion that we can do. But going back to the overall question of how to persuade all of us citizens to do the right thing, because we have seems to have relaxed
on what we need to do.
And what we need to do, indeed.
We'll circle back on that question later on in the conversation, as we also come back to the money question on what needs to be done by whom. Let's bring in Dr. James Nyoro, who's back on the line. Paul Asano, we lost you. Dr. Nyoro, as you were just painting the picture for us of how Kiambu County is, just go back to that point that you were making.
Yeah, so what I was saying is that, of course we expected that the road would be heavier than most of the other counties. Some of us who are within the metropolis expected that there is going to be an increase, particularly from people flowing out of Nairobi. And one of the things that we did, honestly, even using monies beyond the so-called 5 billion, was to add bed capacity. And that was very necessary because initially, even if you can remember, our hospitals were congested because traditionally, and we are happy Nairobi has been able to open up several, level 3 and level 4 hospitals. Before that, we were getting patients from Nairobi coming to Kiambu. So we already had a problem at that point, and we came up with a strategy long before COVID that we need to expand our space. And therefore, we increased our bed capacity by about 1,000. You remember there was a time when every county was asked to expand by 300, so we expanded by 1,000. Mm-hmm. But coming back to what Governor Muriithi is talking about, the medicine, and this we got right from the beginning. The real medicine for COVID is oxygen. Mm. And when everybody else was talking about ventilators and they were demonstrating how many ventilators that they had, what we did was to actually put bulk oxygen into our level 3, level 5 hospitals and 2 level 4 hospitals. And also, just like what Governor Muriithi has said, provided oxygen on cylinders to level 2 and 3s. So the first thing that you want to do, and I can tell you from the first and second wave, I can tell you that we saved hundreds and hundreds of people because of bulk oxygen. And that is what we are seeing now. If we are saying that, if you have 70 patients, 50 of them need oxygen, then oxygen is dawa number one.
Yeah.
Mm-hmm.
The second one is the medical personnel, because with those increased numbers, you need people like critical care nurses.
Yeah.
Yes, we can say that the ICUs are getting full, but they also, a lot of countries did not have the experience of running 30 or 40 ICU beds. Now we have about 32 ICU beds. We need very highly qualified staff because, the way this disease is going is when you come in, you probably be put at the oxygen. The number of oxygen you get, like for instance, in a plane. Mm. But going deeper, it gets more complicated up to the point where you are put on a ventilator. And that requires very specialized, personnel. And the question was, even for a county like Kiambu, do we have the specialized personnel? So we've been struggling, but what I can say is that it was also coming in, as Governor Muriithi has said, who is the chair of finance. It was also coming in at a time when we were running low on resources.
Yeah.
And you require to buy additional non-farm, you require to buy additional farm, and all of that. So we are seeing now some response, but I can say that it requires a lot of concerted effort. In terms of treatment, preparedness, yes, we have some space, despite the fact that we are still close to Nairobi. Of course, I don't want to say this, but we are selective also on who we admit. Of course, we will not fail to admit a very, an emergency patient, but we are being very careful, otherwise we get overwhelmed.
Right.
But overall, I think we are saying that we need to move to the protocols. The protocols are what is going to save us.
Yeah, at this point.
The wearing of masks, the keeping of, these big meetings. If you go to the bars, they've gone back to normal. If you go to public transport, the matatus are carrying full.
Yes.
Bodabodas are carrying 3 people. We have to go back to the protocols because from the experience of phase 1 and phase 2, what saved us is when people got worried and they kept up and they avoided crowding and they avoided all of that. So the two must come together.
It looks like, it sounds like that is the message that's coming out, regardless of clearly the problems that we are having when it comes to finance and getting all these things in order. When it comes to finance, questions of beds and are there enough? Is there enough oxygen? Governor Ndiritu, are we saying that is the message? Even while we are saying, all right, 47 governors need to go back and figure out how this is all supposed to work out in liaison with the national government. But then Kenyans, really, we're asking you, as we're in the kitchen sorting this out, we're asking that you take care of yourselves. Is that what we are saying to Kenyans right now?
That and more would do, because they remember that truly just about all counties did invest in the 300 isolation beds. And as you heard from my colleague, Governor Nyoro, some counties, in fact, invested a lot more. Kiambu, for instance, with 1,000 beds. So that's the expansion. But remember what we have learned. What have we learned about this virus? The isolation is okay, but they go back to this point of oxygen, and really that's where we are, or that's the big point we've learned, that for patients who exhibit very, very strong symptoms, it basically, because what is the virus doing? The virus is basically, if I can use a layman's sort of medicine here, the virus is collapsing your lungs. That's the layman way to think about it.
Yeah.
And that's why the support for oxygen is very, very important. But the general, if you have some general symptoms that are manageable in an isolation ward, that capacity is there. The issue we are talking about is the capacity to deal with oxygen. And remember, colleagues, the virus there is no real cure for a virus. The thing about virus is the speed or velocity of transmission.
Mm-hmm.
And I hope we all understand this, because otherwise the whole thing is a bit difficult to
right.
to digest. We will all, by the way, many of us probably have had COVID already.
Mm.
The speed of infection is what the problem is, because when the speed is very high, then the virus overwhelms the health system.
Yeah.
So these things that we are asking the citizens to do are to reduce the velocity or the momentum of force
Mm-hmm.
of infection.
Mm-hmm.
Now, and that's very, very important, because once we understand that point, then we can see why. Now, you can ask, for instance, people have been saying, remove this curfew, why are you? Look, when people are together over a long period of time in a room, you create very good conditions for the virus to spread.
Are you inadvertently, if I can interject, are you inadvertently saying that we need to shut things down to break the chain? Is that what you're saying right now, that we need to stop movement, inter-county movement, for example?
No, I have not said that, Odu. What I'm saying, I'm trying to explain, for example, why we have maintained curfew and said, okay, social places close at 10.
Yeah.
Or close at 9, actually, not 10, so that then people can get home by 10.
Right.
It is trying to reduce the amount of time that people are spending in a crowded space together. And the reason you're doing that is to again, lessen the conditions for the virus to spread. When we say that in church or in mosque, let us have 1/3 of the congregation, again, is an effort to reduce crowding, is an effort to reduce people, create the distance so that you are lessening the chance of spread.
Right.
So that's all I'm trying to explain. And if people understand that, then wearing of masks, maintaining social distance, avoid crowding, those are very basic, straightforward issues that are actually what the answer is to this third wave.
Whole third wave. Let's take a break at this point.
And that is the message. Odu is asking, what is our message? That's our message. Avoid crowding, maintain social distance, and please, for heaven's sake, wear a mask.
Right.
Now, those things, all of us as citizens, we need to do those things.
And then we
On
see
the
what the
money
government
side.
will do. Let's take a break,
Yes.
and then you'll come and tell us, what is the government going to do as we do all those things? 27 minutes after 8 o'clock, we're having a conversation with Governor Ndiritu Muriithi and Governor James Nyoro. The Governor Ndiritu Muriithi is the governor of Laikipia, and James Nyoro is, of course, governor of Kiambu County. Q talked about what we as the people can do. Ask now what your government shall do.
Well, let me get.
No wonder, Eric, it says in the promo, Asian provocateur. Governor Nyoro, proceed.
Okay. I think, like we've said, what the counties are doing and what we should continue to do is first and foremost to continue to be prepared. I think we all know, and I think for people like Governor Muriithi, probably the third wave has not really penetrated deeper into the rural areas. We are suffering just like we saw in the first wave. Nairobi suffered first, and then of course it was transferred to the rural areas. I think one of the things really that we need to do as governors, as counties, is to continue to prepare. And we prepare in many ways, where we can be able to identify more hospital bed facilities. I think we need to do that because that is going to be expected. Even like for us, even with 1,000 beds, we are starting to think about where we can get another 200 or so. But more importantly, and this is very important, if you have 50 people who are on oxygen and they are being provided oxygen through the bulk tank, what would happen if the bulk tank runs out of oxygen? All the 50 are dead.
Yep.
And this is where it becomes very, 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 very precarious. So we have to be able to ensure that the reordering levels is such that it is probably at 60%. If you run down the bulk tank at 60%, you have to reorder. So we are assuming that BOC and other companies that are making oxygen available will be able to cope with that demand, because you can see the kind of disaster that would happen if that is not there.
Yep.
So increasingly, we have to have our people dedicated, and obviously better managed so that they are not overwhelmed.
How can we get away, though, from this preparation on the go? Because it looks like that's what we are doing right now. It's like, you're having 12 guests coming over. You prepare for one guest, and then when the second guest arrives, you send somebody to go buy tomatoes and onions, and then we start cooking while the second guest is on the way. How can we get away from this preparation on the go and actually have things ready in advance?
No, not really, and I'm not very good at cooking for guests and all of that. But it's not that, that's not the case, because from the experience, the first wave was not as bad as the second wave. And to be honest with you, this is a very mysterious virus. Nobody ever anticipated that in the third week or so of the third wave, all the hospital beds in Nairobi would be taken. I mean, we knew that it would happen, but not to the magnitude that this thing is happening. I know we all need to plan for the worst so that we can experience the better. But, like what my colleague was talking about is that we have also been suffering from some of these financial inflows.
Sure.
And remember, when we talk about reordering oxygen at 60%, you have to have money.
Yep.
BOC is not going to give you free oxygen just because you have 50 patients who are, on oxygen. So you have to have money. So I think the plans are there. You remember when we talked about 300 beds. We thought 300 beds are a lot of beds. And now we are saying that even at 1,000 beds, that's not enough. So I would say that treating this virus is like shooting a moving target. Every time you aim at it, it moves. But we have to be able to respond. We have to ensure that we have enough ambulances that are located at strategic places, which is what some of us are doing. You also have to ensure that you have enough farm and non-farm so that you don't get medical personnel saying they are going without PPEs and all of that. But more importantly is what we started off with, which is what are we going to do in order to reduce the numbers?
Sure.
And that is all of us. You talk about this curfew, and you can try today. You'll probably be lucky. You can travel from Kiambu to Gong between 10 and 12, and nobody will arrest you. Nobody will stop you. So the curfew may be there in theory. It is not there in practice.
In practice, it's not there.
Therefore, what is happening is that bars, instead of closing at 9, they are closing at 10. So we are saying that there's a lot of concerted effort that needs to be done, even within the existing protocol, in order to reduce the numbers. But once we have the numbers, we should be prepared for the numbers.
You make it sound like it's somebody else's job, Governor, but also you have a role to play. Even if we talk about enforcement alone, in the enforcement of things, you have a conversation with the county commissioner, you have a conversation with the county police bosses. What are you doing to ensure that in Kiambu County, all these measures are being enforced and being adhered to?
Well, as you probably know, when we had the meeting with the president, when he announced the new protocols, we established the Intergovernmental Forum that is co-chaired by the governor and the county commissioner. We've already set up that. We've set up certain conditions that are going to be met. But you know, at the end of the day, you probably even hear the police commander or the police themselves complaining about this and that. All we are saying is, yes, we have the responsibility of preparedness, which is what 100% I'm responsible for. Security is not devolved, so we can only come together and agree, like we have agreed on a protocol with the county commissioner and the county commander, that this is going to be done. If it is done in Kiambu, I'm not so sure how it will be done in Nairobi, because people are flowing from Nairobi from Kiambu to Nairobi. So it all requires concerted effort, and that is why we've never had this intergovernmental relations and collaboration that we are having right now. Is a test, but all of it all amounts to we have to ensure that we don't drop our guard.
Governor Ndiritu, I must say it doesn't do very much for public confidence when you tell us that we should be looking for. We're trying to get resources in place to get some of these things done when arrears for November are just being cleared less than a week ago. It doesn't do much. So now we are saying, okay, so we're talking about preparedness today, and we're looking at county bills that have not been sorted out for the last 5 months. So what are we talking about here? Are we ever going to get to the place where things are running the way in which they should be running? We're able to, even if it's do a little bit here, there, the other place, but maintain some kind of equilibrium when it comes to operations. And now you throw in a pandemic into all of that. How on earth are we able to get to the place where money flows in the way it's supposed to flow? Things get done in the way they're supposed to be done. Because you look a bit worried. I must be honest. You look a bit worried if November arrears are being cleared in March, and then you got to ask yourself, how are we going to get there?
I am worried, Udu. I am worried, and I have I'm sitting on the hot seat as chair of finance for the COG. So it's my responsibility to engage our colleagues at the National Treasury on a regular basis to unlock some of the things that are delayed. Truth of the matter is that we have struggled with cash flow. Now, of course, I hope you realize, Udu, that it's a sort of a negative spiral, if that is English. So because when we closed the economy, it meant that we are collecting less tax, which means we have less resources to fight the pandemic. But we have to close the economy in order to fight the pandemic. So it's a bit of a downward spiral. Having said that, there are opportunities, and we continue to engage our colleagues at the Treasury. There are opportunities for them to do the correct thing. Now, it is not true. We cannot really say that there is no money. I mean, it's an issue of prioritization that we believe the National Treasury can improve on targeting what really are the priority expenditure and what can we be able to postpone as we deal with these things. As I just said, yesterday we had a very useful conversation about a pocket of some resources that have been basically held up because of legal hurdles. What I mentioned, the 4.6 billion of the Kenya Devolution Support Program. We have some other little pocket of money, like 600 million to fight desert lock. Pockets of money that are held up because of some legalese or some administrative hurdle. And we engaging with the team, we could see that we can make progress very quickly on those. And as I said, additional refocusing of resources. Now, national government has, of course, a variety of priorities that you can see. For instance, you can see the effort to complete a whole bunch of infrastructure projects. And that's fine, except that if it is putting the strain on the cash flow, then it cannot be said to be fine.
Yep.
So there is room to improve on prioritization, and that is what we need to continue to engage. This issue of resources for devolution is an ongoing debate that sometimes makes us believe that there may be officials who are not very friendly to devolution. Because, you see, frankly, Eric and Udu, I don't recall the last time the national government was late in paying its workers. Meaning, you know, by the 24th, 23rd of every month, they know they have payroll costs to meet.
Yep.
Now, counties are 3 months behind. They have to make certain local arrangements to look for ways to pay. Who are we paying? The same frontline workers that we are expecting to be fighting COVID.
Right.
Yeah, so there is some space for improvement in the way we are managing the cash flow nationally. And it is not just to criticize our colleagues, that really, those are the facts.
Those are open and plain facts. And I think sometimes we approach this matter with some kid gloves, Governor Ndiritu. Maybe it's about time we said, let's have an open and serious conversation about how we are managing my finances and prioritization of projects, like you said. So there's this clamor to finish some infrastructure projects before the term is over. But at the same time, counties are starved of cash. So where are are those the right priorities? And is that a proper balance?
In fact, you know, there are very straightforward solutions. They would involve the central bank if the central bank was minded. Look, the County Allocation of Revenue Act has a disbursement schedule that points out how much will be sent to Kiambu in February, how much will be sent to Laikipia in February, how much will be sent to Kajiado in February, how much will be sent to Mandera in February. My view is that the way the central bank ought to interpret this law, they do not require an administrative action by an official of treasury in order to disburse money.
Right.
And central bank maintains an overdraft for the national. So it should actually be a very simple thing that if Patrick, the governor of central bank were to interpret the law in a forward manner, they would simply disburse and maintain a 26 billion facility for national government, where they disburse from on the 23rd or 24th of every month, because the law already exists. And the law contains a specific disbursement schedule. Now, the problem we have, all of us, is this very conservative interpretation of law, the need to create administrative, administrative steps, where we use those administrative steps to defeat the spirit of the Constitution and the spirit of the law. I believe myself that it is possible, and it is possible because the mechanism or the banker for all of us is central bank, and what that banker should do is simply maintain an overdraft facility for the national government at about 30 billion, and be able then to disburse from that as the time comes. But this we need to continue to pursue ourselves to interpret the Constitution in a liberal and forward-looking manner, not in a conservative manner, and seeking to hoard administrative power because you are the one to sign to say whether the money is going to go to Kiambu or it's going to go to Mombasa, and you want to be left with that power. It's not necessary.
Hopefully we shall cross over to Canaan and those things will be able to happen when we get there. In the meantime, both governors, we're talking about, so for example, Governor Nyoro, you've told us what you and your government are trying to do in terms of looking at this third wave. What needs to happen now? You're thinking about increasing the bed capacity, looking at oxygen and how you buy the bulk oxygen, how you place ambulances here and there. That requires coordination with your neighboring counties as well. And this is where the issue of that coordination from county to county and national government comes in. Are you having those conversations, for example, with your neighboring Governor Mwangi wa Iria of Murang'a, the Deputy Governor of Nairobi, the Governor of Kajiado County, the Governor of Machakos? Are you having those conversations?
Well, not directly, which is something that we need to have. You remember at the beginning there was the issue of creating the metropolis counties to work together.
Yeah.
But that did not take place. But that is happening through the coordination of the Ministry of Health. I think for us as COG, we'll probably need to come together as a caucus and ask ourselves how we'll be able to, look at that, not just for COVID, but even issues such as, transportation, BRT, and all those other issues that, affect all of us. But through the Ministry of Health, we've been having consultations, particularly in terms of what they will need to do, because they cannot continue to put resources in Nairobi without realizing that this will spill over to our counties. For instance, as Governor Muriithi was talking about, we are already requesting for support to increase the bed capacity. We are requesting for support for additional oxygen and oxygen supplies, so that we do not turn away patients coming from Nairobi to Kiambu, Kajiado, or Machakos. So that can only happen because what we are talking about are patients that may not necessarily be from Kiambu, and therefore we need to be supported in a way that we can extend that support to those patients. But I think overall we need to rethink the whole idea of the Nairobi Metropolitan authority or whatever it is that brings together the counties that are around us. If you go back to that old story that you started off with of the 5 billion, when it was being allocated, it was not allocated according to proximity or the epicenter of the problem, which would be Nairobi and Mombasa. It was allocated depending on the population. And therefore, there are certain externalities that we as a county are suffering because of factors that are beyond our control. So I think that coordination may probably come in. But I think what we need to do now, and I agree with my colleague, Governor Muriithi, that National Treasury need to respond and respond quickly because it's life or death. But on our part as the counties, we also need to prioritize and make sure that whatever small resources that are available, we can be able to enhance on the treatment and the care. But overall, a lot of the observation of the protocols will probably go beyond boundaries, and that is where we as a nation, like for instance now, we will be having Easter break. What are we saying? Are we telling people to go to Kisumu and
travel,
Laikipia, Muriithi, and come back on Easter Monday when they have spread, the virus to the rural areas? So there are certain national interventions that will trickle down and improve the efficiency of the counties themselves. Okay.
Vaccines are in the country now, and I guess for both of you. So now this is something that the conversation is big, in as much as we're dealing with people who are sick at the moment across the country. We're also looking at this first defense when it comes to protecting from COVID. Vaccine rollout happening now. What are your thoughts in terms of what needs to happen? Are we sticking to frontline in your county, or are you saying it's time to let everybody come out and get this? And have you seen the activity of vaccinations rolling out for both of you?
With the exception
Go on.
With the exception, I think either yesterday or the day before, when we had quite a number, I think a number of 8,000 was reported, medics who got vaccinated. The reality is that the uptake has been slow, and we are quite worried that the medics and health workers have been a bit anxious about this vaccine. We know, of course, it's partly because when some European nations withdrew and said, there were these side effects, that conversation did not go very well. Fortunately, even those European countries have since their own health organizations have since cleared this vaccine. So we hope to see a bigger uptick. And remember, Udu, that the vaccine itself has a shelf life. So it's not as though you can keep it forever.
Forever, exactly.
Yeah, so it would be really sad if the current batch were to begin to expire before we have vaccinated people. So on Monday, one of the conversations we are having with Dr. Amos and the other colleagues in the Ministry of Health is whether we shouldn't now collapse phase 2 into phase 1. You know, we had said we just start with the front line, but now maybe it's better we bring some of the phase 2 people into phase 1.
That's true.
Like the elderly and the vulnerable, so that we don't get caught out.
Absolutely.
So personally, I advocate opening, but because the vaccine, we only had like 1 million doses, you have to open in a certain manner, so that maybe we start with the most vulnerable, particularly the elderly and people who may have underlying conditions, and then move broader to the general population. On the question of coordination among us, I agree. I think that there is an opportunity for improvement there. I hope you also, of course, realize we run what we call a referral system. So, for instance, at Nanyuki, 30, 40 kilometers into Meru, that whole territory uses Nyanyuki Hospital. 20, 30 kilometers into Nyeri, they will use Nyanyuki Hospital, because the hospitals don't work by way of administrative boundary.
Yeah.
They work by sort of logic of geography.
Coverage,
proximity to, yes.
Yeah, exactly. But I agree with what both you and Dr. Nyoro have said. I think there is a space for improvement there.
Dr. Nyoro, tell us about vaccine rollout in Kiambu as we conclude.
Yes, well, I think it's the same. We saw some apathy, particularly from the front-end medical staff. And like Governor Muriithi has said, this came at the wrong time. I mean, personally, I took the vaccine, and the following day, Italy stopped, and I don't know, Austria and Germany, and I was asking, what did they know that I did not know? And it is very sad when you see the front health care workers declining to take the vaccine. So you would imagine what would happen to a common mwananchi, because they are thinking that these are the people who have gone to school. They understand what the vaccine is. They are the ones who have been vaccinating us against polio. And now here they are, and they are turning it down. So I think for me, I agree with Governor Muriithi that maybe we may want to change phase 1. And be careful, because, again, this is Kenya. And you know what has been happening even yesterday in the papers, that some people are selling the jab. So we need to enter into a very clear protocol of saying, let's now go to those with, pre-existing conditions, to the elderly. And probably through that, some of the front healthcare workers will realize that others are getting it and they'll come on board. But others, we cannot continue at this pace. And I know that, for instance, in Kiambu, there are so many people who are calling me, asking me if they can be vaccinated. And I'm telling them no, because we are waiting for the front healthcare workers to take it. So I think this is a decision that, and you remember also, there was a bit of discussion on whether governors should be vaccinated or not. And quite a number of people are saying that they shouldn't, and others were saying, be it from the front. Let the people see you being vaccinated, and then others will follow. I don't know whether when we were vaccinated, whether others followed. But all I'm saying is that we need to review some of these arrangements because of circumstances that come in that may not be anticipated.
Governors, we want to thank you very much for joining us this morning and for the insights that you've shared with us. Governor Ndiritu Muriithi of Laikipia and Governor James Nyoro of Kiambu. Asanteni sana, and we'll hope to have you again soon.
Thank you so much.
Thank you very much, and have a great day.
Asante. You too.